Hi, Megan. Nice to speak to you again. How are you doing today?
I'm good, thank you. How are you?
Yeah, I'm doing all right. We already talked about the hot weather earlier, so I guess we have to manage it that way.
Yes.
All right, so thanks for doing this with me. So, yeah, we're gonna get into it now. So, can you introduce yourself?
So, my name's Meg. I work in audiology at the Royal Derby Hospital. I work in the hospital in Derby and also Burton, so kind of across site. And I work with adults and with children and doing balance as well.
Okay, so you're a second year STP, right?
Yeah, second year, just coming to the end of it. So, going into my third year in September.
All right. So, what sort of things have you been up to recently?
So in work, I just started in the pediatric department. So I started testing hearing of children from any age, from infants all the way up to 18. And my uni block has kind of ended now for the year. So I've just handed in my ethics submission for my project. And I'm waiting to hear back from that. So hopefully I can start my project in September.
Yeah. Okay. Talking about your specialty then, what is audiology about? I know it's about hearing and all that. So can you talk us through what your specialty is about?
Yeah, so in audiology, we test hearing and balance in adults and children. We diagnose hearing and balance issues, such as the obvious one like hearing loss, but there's also things like tinnitus, hyperacusis, processing disorders, and then in terms of balance disorders, we've got things like Meniere's, BPPV, vestibular migraine. So we have a whole battery of tests that we do to look for these things. And we work closely with ear, nose, and throat doctors, people like audiovestibular physicians, teachers of the deaf. So, yeah, there's a wide expanse of tests that we do and people that we work with.
So, specifically then, what does a clinical scientist in audiology do? Because you mentioned that you guys work with doctors. I'm sure there are other people that you also work with in your department. So, specifically, what does a clinical scientist in audiology do?
So, clinical scientists in audiology will be involved in the testing with patients, but also more kind of on the research side of it and being involved in writing SOPs and doing audits and things like that. So, being more involved in kind of designing the tests that we do and sort of managing that.
Yeah. Okay. So when you say research, are you guys probably coming up with new stuff or maybe developing the current procedures that you have, or what kind of research do they do?
So, not really changing the procedures that we do have, because that would be like on a national level. But I imagine an established clinical scientist would be involved in more research to do with like service improvement and things like that. So, kind of audits and like questionnaires in terms of what staff and patients find helpful and improving the way that we do things, but not necessarily changing procedures or guidelines.
Okay. So you mentioned that currently as a second year STP, you are doing some pediatric stuff. So what kind of things did you do in your first year?
So in my first year, I did a lot of shadowing different healthcare professionals. So with the STP portfolio, there's a lot. You have to kind of shadow lots of different people. So I shadowed like ENT doctors, teachers of the deaf, audiovestibular physicians, clinical scientists in other areas. So I shadowed a biochemistry clinical scientist, a microbiology clinical scientist. And alongside that, in audiology, I was kind of doing a lot of observing of the clinics because I hadn't didn't have any previous experience. So watching the different type of appointments that we have with adults and children. And then I also did 2 rotation placements. So I did placement in ophthalmology, which is where they test eyes. And then I also did a placement in neurophysiology, and where they do a lot of neuro tests, such as EEG and things like that. So they were all really interesting. So I watched them and then wrote my reflections on them and uploaded the evidence onto the portfolio.
Yeah, okay. So you mentioned not having any experience before the STP. So what was your pre-STP background, and also what kind of experience did you have? Did you get in straight from uni, or how did you get in?
So I did a biomedical sciences degree in Manchester and I graduated in 2018. And then I worked in a lab, so I started as a biomedical assistant in like a haematology and biochemistry lab in the hospital. So I was like an assistant there, and then I worked my way up to become a biomedical scientist in haematology across a period of about 3.5 years, and that involved like doing a portfolio and training there and everything. So I knew a lot about blood, but not a lot about ears. But I always wanted to get onto the STP, so I was kind of applying like every year. So I applied 4 years in a row, but it's just competition ratios were just so hard. I never thought I was going to get in. But when I qualified as a biomedical scientist, I don't know whether that kind of gave my application an edge or something because I was like professionally registered. And then that was the year that I got into the STP.
Okay, so I'm just curious, as a biomedical scientist in hematology and everything you know is about blood, how then does that relate to audiology, or how did you decide that you are going to apply to the audiology ST?
Yeah, it's like a bit of a weird jump. But essentially, when I was at uni, I liked all the sensory sciences stuff. So I liked the ears, the eyes, the brain, all those kind of things. And after uni, when I didn't really know what to do, I went to an STP open day and I signed up to like, you could go look around a department and they just like randomly assigned you on based on the numbers. And I got assigned audiology because I put an interest in that. So I went to look around an audiology department in Manchester, and the ladies that worked there were just like really enthusiastic about the job, and they were like, "It's so niche and it's really interesting, and a lot of people don't know about it." And I just thought, "Oh, that's really cool." So then that year was one of the years when you could apply to two specialties. So I applied to neuro and audiology. Um, but then never got in. And then after that, I just kind of kept applying and eventually got in. So yeah, it is a bit of a weird jump. It was like I kind of knew how to work in a lab, so that was like an obvious job for me to go for. And I kind of thought it was going to be like a job, just as a in between job before getting onto the STP, which I kept trying to. But it just ended up being like 3.5 years. So like COVID was in the middle of that. So, I feel like I kind of slowed down with trying to do things with my career because we were just locked down and not really doing much. So I'd like to think I might have got onto it sooner if that hadn't happened.
Yeah, yeah, I see. So, as someone that applied 4 times, did you make any obvious changes in your application? Yeah, I know you eventually became a registered biomedical scientist and probably you had an experience, but I'm just curious because your experience is in hematology and you're applying to audiology. So, did you use like transferable skills or trying the 4th time? So what did you do differently and how did you tailor your application to reflect what they want to see for audiology?
Yeah, of course. So I think each year I read up more about what they actually want in the application. And so every year I tried harder to actually like just answer every single question. So like there's like a list of stuff that they kind of want you to show. And I would like put that on a Word document and then map out for each point exactly what I had. So like even though it's hematology and it's a different specialty, like you said, like use transferable skills. So I'd write about things like calibration and like quality control, the fact that I did like audits, time management was a massive one. So like in the lab, everything has to be on time. And obviously, like I didn't work with patients, so I couldn't write about like skills with patients, but I wrote about things like how I interacted with my colleagues and things like that. And when I'd done jobs previously, I'd worked in like retail, so I wrote about that. So each time I did the application, I just like looked at exactly what they wanted, what kind of skills, and then just like mapped it out to exactly what I could, and then tried to make it more like efficient, my writing, and like get everything into the word count. So yeah, I think I just perfected it a bit every year, really.
Yeah. Okay. Well, that's a lot of work that you've done there to get into the STP. So now that you're in a specialty that is patient facing and your previous experience was lab based, what was the shift like for you? Did you have any issues moving into a specialty that is patient facing, or how are you finding it now that you're in a patient facing role?
Yeah, I think at first, the main thing was just getting used to talking to patients. Like I didn't know how to do that before, and I think I've perfected my skills of, I don't know, talking about the weather and things like that. Just little things like small talk to get used to talking to patients. But yeah, I feel a lot more confident with talking to essentially strangers now, and because you kind of just you see 15 a day and you just have to just chat with them. But at first I found that a bit daunting because I thought I don't really know how to chat with strangers all the time. But you just kind of like, the more you do, I feel like the more you just develop that skill.
Yeah. Okay. So, about the STP again, what is a typical day in your life like as a trainee clinical scientist?
So at the moment, I'm in peds. So a typical day. So I do 8 till 6, 4 days a week. So I'll come in at 8, have a chat with my colleagues, and then we start work at 8:30. So in peds at the moment, I've only just started, so I'm not seeing patients like solo, but I'm being put with other people. So on Tuesday, for example, I had like a morning of, we call them like one tester appointments. So it's where one person is testing a child, like a school age child. So they could be anywhere between 3 and 18. And the appointments are half an hour long. And they'll be coming in because they've been referred for things like speech delay, or parents have got hearing concerns. And the audiologist will do like a quick history, have a look in their ears, do a pressure test of their ears, and then do a hearing test. And for the children, the hearing test differs depending on their age, and their development. So for like a 3.5-year-old, we might do what we call play audiometry or performance audiometry, where we get them to listen to sounds either with headphones or with like a sound in the room. And then we condition them to, when they hear the sound, they put like a man in a boat or like a ring on a stand. So it's kind of like a game. But as they get older, we can do pure tone audiometry, which is what we do with adults. So essentially they just wear headphones and then they have a button, and then when they hear the sound, they press the button. And then based off the hearing test, we'll just explain the results to the parents or the child if they're older, and then explain, what they can do from there. So a lot of patients will be discharged because they've got normal hearing. Some, for example, the other day we had a couple of like glue ear patients. Glue ear is just kind of like a congestion kind of issue children get a lot, where they have congestion in their ears and it can affect their hearing. So we would just kind of, if it's the first time we saw them, we'd just tell them to like help, work out if they know how to blow their nose or like things like that, and then bring them back in 3 months' time. So I might do that for like a whole morning, help my colleague do those. Eventually I will be doing those appointments by myself. And then we'd have lunch for half an hour. And then in the afternoon, I might do like observe like a 2-tester clinic. So this is where we have 2 colleagues doing a test for one patient, and they will be like between infants. Well, there'll be an infant, so under the age of 3. And we'll probably do like a VRA test, which is where you condition a child, if they hear a sound, to turn towards something like a box that lights up with like a pop in it or something, and you can work out their hearing from that. So yeah, that would be like an afternoon clinic, and then finish about 5:30, do some admin, and then go home at 6.
Okay. So, do you get a study day?
Yes, I get one study day. My study time is like 20% of my overall time. So I have one study day a week, and then every 4 weeks I replace that study day and go into work. So that works out as 20% just because we do the longer days.
Yeah. So that means you work mostly 3 days a week, then you have your one study day. Okay. So when you become competent in a particular assessment, are you allowed to perform it solo since you are still a trainee? So do they allow you to perform an assessment alone?
Yeah, so yeah, they do. So in the adults department, which I've been in more, I'm now doing appointments on my own. Not all appointments, but things like hearing aid fitting appointments and assessment of hearing aids of patients that have already been there for a while. So yeah, I've been doing those solo since about September last year. But at first I had, say, like half an hour gap between appointments, and then that gap went down to 15 minutes, and now I don't have any gaps. So it's just been working out time management. But yeah, now I try to stay in time. There's still a couple of times that I don't, but I'm working on it. But yeah, I do see patients on my own. But there's always somebody around. So if there's no like band 6 in the department, I can't see patients on my own, but there always is anyway. So it's okay.
Yeah. Okay. Sounds like you guys have a lot of interesting things that you do in your specialty, seeing patients and all that. So, what has been the favorite part of the job for you? And do you miss working in the lab?
Favorite part of the job is definitely talking to patients all day, I think. Like at first, like I say, it was a bit daunting. I didn't really know how to talk to patients, but eventually you just realize it's really interesting. Like every patient is different and they all come with their own stories. And a lot of them are like really appreciative. And there's been a lot of emotion sometimes when people fit with hearing aids and they could suddenly hear, like, that's really nice. So I just like chatting to people all day. Yeah, I do miss working in the lab. Like there's things about it that I loved. And like, you know, in an ideal world, like I'd love to be able to do that as well as this job. Obviously, you can only really have one job. The lab was interesting because it was very like the finer details, like everything was organized like really well. And like I loved like cell biology and things like that. Being able to analyze blood and like the components of it was just really interesting. The problem with the lab for me is that there was no like, you never saw the outcome of it. So it was like you test a vial of blood and you see, you might see this person's got malaria, but you don't actually see the patient. Like it's just a vial of blood at the end of the day. You just send the results off and then that's it. Like you don't see the repercussions of it. So, whereas I like in audiology how I can be like, okay, you've got a hearing loss, let's fit you with a hearing aid. You fit them with a hearing aid and then you see them back again in 6 weeks and they're like, oh, I can go to my knitting class now. Like I can chat to my friend. I really like it. And you just like can actually see what kind of difference you've made.
Yeah, you can see the impact you're making in the person.
Yeah.
And that I'm sure that must feel very nice.
Yeah, yeah, it does. It does.
I did a hematology rotation, and one of the competency took me to a hematology clinic, and that was the first time I got to see like patients. And just like you said, some of them coming very excited. Maybe they've had a bone marrow transplant and they are getting better, and some others will come in and they've had a failed one and they are feeling really sad. So it's just like a mix of emotion. I don't know how you guys manage all that, but telling someone that the procedure didn't work, I found that really stressful. I don't know how you guys manage the emotion. I think that should be the next question. How do you manage the emotions with working with people? Probably, I don't know if you guys maybe have a situation where you have to maybe tell someone that they might not be able to hear, or maybe a bad news or a good news. So how do you manage emotion within your specialty?
Yeah, I mean, you have to go by what the patient is like. So you can kind of get an idea of which patients might be able to take news better than others. I had a lady the other day who she basically had normal hearing in one ear and then a hearing loss in the other, and she was wearing a hearing aid in this ear. And when I tested her hearing again, she actually had quite a drop in this ear, but she thought she could hear normally from that one. So you just have to basically do a really thorough explanation of the results and say it as it is. Like, don't kind of beat around the bush about it. Make sure that they know, you know, you do have a hearing loss in that ear. And she was quite upset about that. But you have to, like, I made sure to kind of explain what the hearing loss is like and what we can do for it, and like kind of link, okay, the problem with like the management straight away so that they know, okay, we can do something about it. It's good to get realistic expectations on the table as well. Like, make sure people know that, you know, hearing aids can't solve a hearing loss. They won't solve the problem. They're just an aid at the end of the day. But if you kind of help people to get realistic expectations, they can get much better success out of what they've got, because they know what they can and they can't do. So yeah, managing emotions, I think it's good to have emotion, you know, rather than just be like a blank face and just telling people, yeah, you can't hear out of this ear. I'm quite nervous about, in pediatric audiology, I know there's going to be times where I'm going to have to tell parents of a child that's just been born that they've got hearing loss, and I think that's going to be really hard, like an initial appointment. But yeah, I'll tackle that when I come to it and just ask my pediatric colleagues how they kind of deal with that. There's a lot of like counselling that you have to do with patients and with parents of patients, so that's something that I'm learning.
Well, that sounds really emotional. Anyway, going back, talking about the STP again, I know the workload is quite a lot. And for someone like you that work with patients and with busy clinics and all, how do you manage the workload of the STP? Do you get time during work to write up your competencies or training activities, and for the university assignments, and I don't know if you guys take exams as well, how do you balance your time and manage everything to make sure that you're not burning out at any point?
So with the uni stuff, we don't have exams. It's just pure assignment based. So I do those at home. I tend to not really be able to get into the headspace to do writing at work. So I can't really get into like writing an essay at work. So I'll always just do those at home and tend to just do it on my days off, like my study day or my day off. And sometimes I do it on the weekend, but I try and manage my time so that I don't have to do that. But when there's deadlines and stuff, like I do tend to do work on the weekend. Competencies for the portfolio, again, mainly at home. But what I will do in work is I'll kind of like look through the evidence and what I can get and like jot down notes of what, like just like little notes of things that I could use so that I can like look it up at home and then like write the evidence at home. Yeah, sometimes I write competencies at work, but not often because I like to do work at home. I can't really like do the two things together. I like to separate. Like when I'm in work, I want to be busy and just doing things. So yeah, I think the only time that I would have chance to do it in work is when we have a cancellation and things like that. Like if you have a cancellation, you just kind of get on with it, like a bit of work admin or like chat to your colleagues and stuff. So yeah, I don't tend to do stuff at work.
I think the most important thing is finding what works for you, then stick to it rather than just being everywhere and struggling at the end of the day.
Yeah.
Yeah, okay. Then talking about the STP application again. So we're going to talk about the application and your interview experience. So you've talked a bit about your application experience and how you improved your application and all that. So for persons that will be applying to audiology next year, what tips do you have for them on how to like present an outstanding application to improve their chances of getting in?
I would say, again, just like focus on every point that they want and make sure that you can answer every single point in the application. Like, put an emphasis on people skills and it doesn't really matter where you've got them from. Like, I wrote about working in Debenhams and like in a cafe. I said that I got people skills from there because I did. Like, you can use anything. It doesn't have to be like you know, a non-retail career, like wherever you can say that you've got skills from, as long as you know what skills you've got from that place, then you know what you've gained from it and what kind of transferable skills you got from that. So yeah, people skills, I would say focus on that. You don't have to show that you have in-depth audiology knowledge because I didn't. Obviously for the interview, I did like revise a lot of my audiology stuff, but for the application, like I didn't put any audiology detail in there. I don't think. Yeah, more about the skills that you've got and how they apply to the job.
Yeah. Then talking about the interview, the audiology specific questions, was it a lot? And did the preparations you made, did they help you to answer the questions?
Yeah, I think it was about 50% audiology questions, but it's like I did like one day of revising of audiology and I was able to answer most of the questions. I think a good tip is to kind of like research current things that are there about audiology, like what are current technologies, is anything new happening, what was spoken about in like the most recent audiology conference, just like new things, because they might ask about like like a current innovation in audiology. So yeah, that's good to know. Yeah, you don't have to know the ins and outs of the tests, but just know the basics, and you should get by.
Yeah. Then what about the transferable skills and the NHS core value and constitution? You just answered those ones based on your experience, or did you do any further preparations for that?
So I'd done like quite a few NHS interviews before, so I knew like you need to make sure that whatever, well, for the STP it's different, but say you're applying to a certain trust, you need to see what like values they have and get something that you have done for each value. And then the NHS constitution as well, just get something for each part of the constitution that you know that you've done that links with that. So we'll do that for the STP interview, and just know that they're going to ask things like, tell us about a time where you've been stressed and how you deal with it. Like, just link back in your head, just think, what are they actually asking there? They're asking about time management and how you deal with the stress and the load on you and how you actually react. So you don't have to have like I talked about a time where like there was a lady who was bleeding, who was giving birth, and we needed to like give her some blood from the transfusion department. But like that was like a really stressful situation. But I feel like you wouldn't have to have a stressful situation as that. You could just have like, say if you're working in retail and there was a lot of people on the tills, like as long as you can talk about the skills that you use, I don't think it matters what situation you talk about, just as long as you know the question and how you dealt with it.
Okay, that's a good advice. Then, what is one thing you wish you knew before you started the STP? I like to go first for that question. For me, I know that the STP would be intense, but I wish I was more prepared for the level of new things I had to learn. I was faced by a lot of abbreviations, a lot of new terms, and it really shocked me initially. So for me, I wish I was more prepared for that. So for you, is one thing you wish you knew before you started? Yes.
One thing, I think I'll say I didn't really like, I knew there was a portfolio, but I didn't know how big it was literally until the STP open day. And somebody was talking to me about it, but I was already on it at that point, and I was like, wow, okay, that's huge. But there's not a lot you can do to prep for that beforehand. So I'll say the other thing that you can prep beforehand. Like for me, I'd had 4 years out of uni, and like things like referencing, like I completely forgot, like no clue how to do it. And it was like straight in with the assignments. It was like reference this, reference that. You're going to use like databases. And I was like, whoa. So I had to like reteach myself that. So if I'd have kind of taught myself that over the summer before the STP, I might have been able to jump into it quicker. Like they do have library sessions and stuff Aston Uni. So I did like attend those and like ask the library people for some help. I feel fine now. It's been 2 years, but so I should be. But like in the September at the start of the first year when it was like, yeah, referencing, and I was like, God.
Yeah.
If there's things from uni that you haven't done for a while, like referencing, just kind of give yourself a quick update before you start.
Yeah, I also struggled with referencing, though I came into the STP immediately after my master's, but I had to take a step back because in my master's, when you submit your assignment to Turnitin, you can see the similarity percentage. So sometimes if it's really high, you can go back and like do one or two things to bring down the percentage. But during our first lecture, we were told that at University of Manchester, you don't get to see the Turnitin percentage or whatever you submit. Yeah, so like no way. So I found that really stressful, and they were talking about academic misconduct, and I'm like, I felt like it's a different university experience. So I had to go back. They had a whole course on Moodle about plagiarism, academic misconduct, references. So I took my time to do all that course to ensure that like because it felt like a different rule. So I had to understand everything to make sure that I'm in line with what this university wants. So yeah, that reference
Yeah.
but yeah, I wish I did it again. So yeah, that's a good one. Okay, so for someone getting into the STP fresh, that for the people that will be going into the STP next September, what advice would you give to them?
I would say the main advice is just be as proactive as you can. So for me, don't kind of leave the portfolio. Like the university stuff, you will have your deadlines, you've got your supervisors and things like that. They will say, oh, you need to do this by this time. But the portfolio, you need to be super proactive with it. Like your training officer won't always know what you need to do. And you need to be like, okay, what do I need to do? What can I start on? Like any evidence you can get, just start writing up little bits. Yeah, you need to be super proactive with it because there's so many competencies and there's so much to do. And like the deadline of the following year will come really quickly, and then it'll be August and you'll be like typing things out. So I just tried to do so much as I've gone along. I can't remember, is it like the Foundations of Clinical Science module? The competencies for that are kind of all random, like do a presentation on this, do something on that. Just try and get started on those as soon as you can. Like a lot of them you can just do without any help. Like it's things like I don't know, like information governance and things like that. You can show that you've done that, and that can be one of the competencies. So yeah, just anything you can. It doesn't need to be like really in detail or in depth. As long as you reflect well, and you've got some evidence for it, like just get going with the portfolio like straight away.
For you guys in audiology, what university do you attend?
I attend Aston. There's 7 of us audiology guys on the course there, and we are with the neuro and the ophthalmology guys. But then there's like another 20 audiology STPs that go to the University of Manchester. So they kind of split our course, not equally. So yeah, they sent some of us to Aston, some of us to Manchester.
Are you guys doing the same university module? I'm just wondering why they had to split you guys. Do you do exactly the same thing?
I also don't know why they split us. Yeah, I don't get that one, but it worked for me because I live close to Birmingham, so I was happy with that. But I don't know why they split us at all, to be honest. Yeah,
So
kind of.
how did they decide? Is it based on proximity? So how did they decide who goes to Birmingham and who goes to Manchester?
Yeah, I don't know because in Birmingham we've got quite a spread. Like I'm in Derby, I'm the furthest north, but we've also got like someone from Southampton, Oxford. So yeah, I don't know whether people more north of Derby have gone to Manchester, but there's not that many northern positions anyway. Like I think Manchester, maybe one in Yorkshire is like the most north. I know there's like one person from Plymouth that's gone to Manchester, for example. So it's a bit like I don't really know. I don't know whether it was like timing, whether it was like who signed up first to which uni. I just know that I just got told you're going to Aston, and I was like, yeah, that's fine.
Okay, that's fine for us. We all go to Manchester, and yeah, that's just it. So, but how often do you attend? Do you go like I spoke with a clinical engineering STP, and for them they do like a 2 month block, and they cover everything for that year. So for you guys, how often do you go to uni?
So with Aston, we normally do about 1 or 2 weeks in September, then 1 week in January, 1 week in March, and then like a few days in May. So that's the same for most of the years, apart from the first year in the September, you do 3 weeks. So that's it. It's about 5-ish weeks, 6 weeks across the year.
Yeah, that's similar to what we do. But it's been very interesting speaking to you. I think just like the presentation you made to us, I really enjoy listening to you talk about your specialty because it kind of make me imagine what it's like working directly with patients because just like you said, we're always behind the scene, just the tubes, the slides, and that's just it. So yeah, it's always interesting listening to you creates an imagination like, oh wow.
Yeah,
The other
yeah.
time you talked about maybe someone that couldn't hear before and when you fix the hearing aid and now they can hear your voice and how excited they get. It really makes me feel like, oh, that would be so cool. It's been awesome speaking to you. Thank you so much for doing this with me and I'm really grateful, okay?
No worries.